Hi, everybody. Can you hear me okay?
Yes, we can hear you.
All right, very good. Well, it's good to see everybody. Do we have quorum well enough to where I can go ahead and get started?
Yes, sir, I believe so.
Okay, then why don't we go ahead and get started then? And I will call to order this meeting of the statewide substance use response working group for April 10th, 2024 at 2 p.m. And I'll ask that we call the roll.
Chelsea Cheatham,
Present.
Dr. Dixon,
Here.
Senator Doñate, Attorney General Ford,
I'm here.
Assemblywoman Hardy, Shayla Holmes, Jeffrey Iverson,
Present.
Jessica Johnson,
Present.
Dorothy Edwards,
I'm here.
Nancy Lindler,
Present.
Debbie Nadler,
Here.
Angela Nichols,
Present.
Christine Payson,
Present.
Eric Schoen,
Present.
Steve Shell, Dr. Slamowitz,
Present.
Senator Stone, and Assemblywoman Thomas. All right, Mr. Attorney General, we do have a quorum.
Very good. Thanks so much. And hello again, everybody. Great to see you all. Let's move on to agenda item number 2, public comment. Public comment is going to be limited to 3 minutes per person. We'll begin with comments from Las Vegas and then invite comments from Carson City, followed by virtual participants. If you're in person there, please form a line, and before commenting, please state your full name for the record. Next slide so I can read the rest of it. If you're attending virtually, you can dial in from the telephone, and the number is 719-359-4580. When prompted, enter the webinar ID, which is 841-1615-6896, and then enter the meeting passcode, which is 676835. Press 9 or star 9 so the host can prompt you to unmute. And if you're joining virtually with computer audio, please use the raise hand feature to indicate that you'd like to provide public comment so that the host can prompt you to unmute. And again, before commenting, please state your full name for the record. And comments can also be emailed to lhale@socialent.com. And these comments and questions will be recorded in meeting minutes. Do we have any public comment there in Vegas?
Giuseppe Mandel from Desert Hope and American Addiction Centers Treatment Center. Thank you very much for allowing me to be here, as always. I do look forward to the presentation on the jail mod. And I do like to encourage getting my questions in now, and hopefully they'll be answered now in public comment. I do look forward into finding some solutions in the gaps in the system, predominantly somebody who's been in jail for a period of time, maybe over 2 weeks, getting them qualified for treatment coming out makes it very hard based on insurance. And any of the free programs, unfortunately, are not going to accept, that I know of, it won't accept medically assisted treatment, which puts us in an interesting kind of situation to get people placed in the appropriate things. So love to find a solution to that when it's regards to that. I know entities, private entities like myself, or our company, we would take medically assisted treatment. However, insurance, there's that gap there. If it's 2-3 weeks, we won't be able to get them placed with us because insurance won't let us bill for that. So because they've been 3 weeks sober in jail, unfortunately. So a solution to that, any type of free program that I'm looking for a solution to getting somebody to as far as treatment with some of the free programs, which are great programs, but they won't allow medically assisted treatment in. If there is a solution to that, I mean, I'm definitely, I'm encouraged all the brilliant minds in this meeting. I'm sure you guys can give me a solution I'm sure one of you have it. I just don't know it. Thank you guys very much. I do appreciate you allowing me to be here, and I look forward to a great meeting.
Thanks, Giuseppe. Always great to have you, and thank you for your comments. Any further public comment in Vegas?
No further comment here in Vegas.
Okay, let's go to Carson City. Any public comment in Carson City? I take that silence as a no. Okay, then we will go to public comment on the screen. I think I saw Debbie's hand come up. Debbie, you want to go ahead?
Yes, thank you so much. One thing that we're lacking in, which I hope we can discuss, is the mental health aspect. If I'm not mistaken, Governor Sisolak mandated mental health. It was right before COVID. And I just lost a cousin a couple of weeks ago, and it was all because of mental health. And it's just an issue we are just not focused on. And it's like, which came first, the drug abuse or the problems with the mental health, the coping, and all those mechanisms. But there's nothing here. There's nothing in our city. And personally, I need it for me. The moms need it for them. The grieving family members need it for them. There's really nothing in our city. We're so lacking in it, especially in the school systems. And I think it's so important we focus on something starting in kindergarten. That's my comment. Thank you.
Thanks, Debbie. Thanks for your comment. And so sorry to hear about the loss of your cousin.
Thank you.
Is there any further public comment on the Zoom? Is there any on the phones? Okay. Hearing and seeing none, then I will close the first opportunity for public comment and move to agenda item number 3, which is the review and approval of the minutes from our January 10th, 2024 SURG meeting. I will indicate or note that those minutes were distributed to everyone before the meeting. You have them handy there. And if you reviewed those, I will entertain a motion to approve the minutes.
For the record, Chairman Ford, Eric Schoen, so moved.
It's been moved. Can I get a second?
Jeff Iverson, for the record, I will second.
It's been moved and probably seconded that we approve the minutes of the January 10th, 2024 meeting. Any discussion on this motion? Hearing and seeing none, all in favor say aye. Aye.
Aye.
Aye.
Aye.
Any opposed say nay. Any abstentions? Motion carries unanimously. Thanks so much, everybody. Moving on then to agenda item number 4, we are going to be receiving an update on the opioid litigation, settlement funds and distribution. For information discussion only from my colleague, Mark Kruger. Mark, are you there and available, ready to go? Is Mark on?
Yes, General, I'm here.
Oh.
Mark Kruger for the record. My apologies. I had want to give you guys a quick update. Most recently, we understand that the U.S. Supreme Court has reviewed the Purdue bankruptcy plan that was approved and moved its way through the appeals process. It is looking like, and I think everyone is pretty much of the same consensus, that the U.S. Supreme Court is going to reject that confirmation plan, which is going to throw that plan into a little bit of question as to what we're going to do to be able to see funds come from the Purdue bankruptcy. That can happen, or is expected to happen anytime between now and sometime at the end of June when the Supreme Court's term ends. They do expect a decision from the Supreme Court prior to the term ending. That's the big news on the opioid front. If the plan is not confirmed, then it means that the Purdue bankruptcy itself still has to, a new plan has to be generated for that actual company Company does not have a lot of assets anymore. It sold off another company that it owned for $385 million. So they're estimating it's probably valued only about $250 to $450 million. In addition, it throws off the state's claims. We do have an active case still against the Sacklers and Purdue so that we could start relitigating again. The problem is that since the time that we filed, the bankruptcy court took charge of some of the transfer claims, and those claims are some $11 billion that the Sacklers took out of the Purdue company and brought to themselves and their trusts. So those particular claims, or the fraudulent conveyance claims, are going to be the ones that are going to be subject to the jurisdiction of the bankruptcy court at this point. Then there is a question as to whether or not the Sacklers are going to be subject to the bankruptcy court. And the Sacklers obviously are the ones that are controlling most of the money. We have sued. We're one of roughly 30 states who did name the individual Sacklers as part of a defendant in our opioids litigation. So we're actually better suited or situated than most other states. But at the same time, the bulk of the money is still subject to the jurisdiction of the bankruptcy court. From the time that the Supreme Court actually issues its decision, it's going to be expected to be about 30 days before we would be able to basically reestablish our litigation. So there's a lot of questions surrounding that. As far as other general settlements, we have settled a couple more settlements that I think have all hit the press. We're still working with some other states and with our outside counsel to settle additional cases. We call them the Tier 2 and Tier 3 defendants. And in addition to that, we have current still active litigation, including active litigation against some of the PBM case defendants. So things are still moving quite rapidly in the opioid space, and we are still expecting to get additional recoveries, which should also just increase that over $1.1 billion that we've gotten so far as a state, which is exceptional in comparison to the other similarly situated states and all other states, frankly, per capita. That's my report, General Ford. If you have any questions, I'll be happy to take them.
Thanks, Mark. Great report. Any questions from the committee?
We have a question here in Vegas.
Okay, go ahead. Please state your name and say your question.
Hi, everyone. Jessica Johnson for the record. Mr. Kruger, thank you for the presentation today. At our last meeting, you had mentioned that there was work on a dashboard with some of these projects and proposals, and I was wondering apologies if I missed your update on that, but was hoping for just a brief update if you had one.
Sure, Mark Kruger for the record. My apologies. I'm still working with our IT department and with the Department of Health and Human Services regarding the dashboard. We're excited about getting it up and going. We're a little frustrated, but it is something that is brand new, and the IT department is literally building the dashboard themselves. So it does take time. And if I recall, the last time I updated, I said, conservatively speaking, around 6 months. So we're still in that time frame. We're still on track, but it is something that we are working for. In addition, I believe somebody had requested that I put up that chart of recoveries to our website, and I have done that so that you can see the gross chart of recoveries that we have brought in, as well as the state share. So those are actually on our website now.
Thank you.
Thanks, Mark. Any further questions? Okay. Hearing and seeing none, then Mark, thanks so much, sir. You can feel free to log off. Appreciate your update.
Thank you, and thank you, everyone.
All right, we'll move on to agenda item number 5, which is a presentation from Bill Teal, who is a Metro captain, retired, and a jail industry consultant who will give us a presentation on jail medications for opioid use disorder. Mr. Teal, mic's yours.
Thank you, Chair Ford, and appreciate the opportunity and being here with the committee and being able to present. And this is my first time actually presenting in front of a committee, so I just want to make sure I'm doing this appropriately. Should I be sharing my screen, my presentation, or will my presentation pop up?
It's here. This is Crystal Duarte with SEI. Hi, Bill. You should have
Hi, Crystal.
remote control now. If you want to forward your slides, if that doesn't work, I'll forward them for you. And
Okay.
I'm sharing it. I don't know if you can't see that.
Yeah, I can't see it on my end. However, let me see what I can do.
Yeah, all that I see is agenda item number 5. You want to advance the screen? We can see if the there we go. I see them. We see it.
Perfect. Thank you very much. So again, my name is Bill Teal. I'm a retired captain with Las Vegas Metropolitan Police Department. I was there for over 24 years. All my time was spent within the jail. And the last 8 years of my career was a bureau commander, with a big part of my oversight being the medical and mental health services provided to our most at-risk populations, to include those who are suffering from mental illness, substance use disorder, as well as those that are suicidal, and the folks that are having, challenges with all 3 of those at-risk type of categories. And so fast forward to today, I'm very, very excited and appreciative of being able to work with the Department of Health and Human Services in regards to its desire to work on its risk needs assessment related to the opioid use disorder and its impact on our rural jails throughout the state. So please advance the slide. Thank you. And just as a disclosure, so it's understood that I'm actually funded through the Fund for Resilient Nevada. The jail MOUD and community continuation of care effort is funded through this source, as well as there's oversight from not just the Department of Health and Human Services, but also the Nevada Public Health Foundation as well. And so just to give kind of a brief overview as to the work that's been done thus far, last year in March, I was pulled in to work with then Dr. Stephanie Woodard and Don Yohe in regards to creating a survey that could be introduced inside of all 23 of our Nevada jails, and learning about the pain points and barriers to actually implementing a medicated assisted treatment program inside of their jails. And so today, we're actually working through the implementation phase, where we've taken the information that was gathered through the survey that was introduced to all the jails, and we actually have been working towards the development of the jail medication opioid use disorder program with a community continuation care plan model that's being developed and introduced to all the participating counties. Currently, we have pilot programs in both Lander and Esmeralda counties. And we have basically monthly meetings with each of these counties that encompasses a multidisciplinary team made up of state representatives, county representatives, representation from the sheriff's department, as well as other third-party individuals who are also working as contractors with the state. So it's a fantastic professional team of individuals that are all working towards helping these county jails implement jail MOUD inside of their facilities. Please advance the slide. And so in regards to the issues that are being identified, we're using the sequential intercept model as our roadmap to addressing the different barriers, to include, all the different intercepts that I'm sure most everyone on this in this meeting is familiar with. But we're starting with deflection, and then working our way through diversion, intake, jail, and courts, meaning access to care and programs, and the specialty courts, as well as reentry for those folks leaving jail and prison, and then community corrections to include parole and probation, as well as home detention for individuals. So the significance of using the sequential intercept model as a roadmap is that if we can address the gaps at these different intercepts, we're creating a great deal of benefit for both the individual who's caught up in the judicial cycle, but also for the community as well. And it's kind of like a backwards forwards approach, because we may be asking ourselves, why would we look into deflection if the effort is a jail MOUD program inside of the jail? If we can address the needs for deflection within a community, then we're better off in diverting folks from actually having contact with law enforcement and mitigating the perhaps time that individuals would be ordinarily arrested and taken to jail simply because of the lack of access to resources within a lot of our small and rural communities. So that's the significance of working through these the sequential intercept model as a multidisciplinary team. And we actually demonstrated a great deal of success in just finding some low-hanging fruit victories. As an example, the NAMI representation that makes up a part of the multidisciplinary team, it was identified that there was an opportunity for them to provide greater awareness and education for not just the sheriff's department, but also for different representation within the community. Providing them an access to be able to speak to professionals, whether it's a 988 line or the different warm lines and hotlines that are available, as well as for our youth to include the teen text and chat lines that are available for those kids that are in need of access to care. Next slide, please. So if I haven't mentioned it already, the special populations that the jail MOUD effort is targeting are incarcerated adults within our Nevada rural jails. So it encompasses, everyone that's basically identified under that definition of what a special population would be. And, I would share with this group that, the most at-risk population, believe it or not, are women who are in carceral settings and in need of greatest need of access to care. So we're targeting all the special populations to include the youth. The next step that we'll be taking is currently working with Don Yohe in the development of some scope of work for expanding this effort into our youth carceral settings. So we can take a similar approach that we did with our adult jails throughout the state. Next slide, please. So what's working well based on this approach that's being taken? So for our research that was conducted in 2023, this phase provided awareness of the gaps, and we'll get to see some of the aggregated data, that was collected for that time period. But it helped kind of pinpoint where the challenges lied within our small and rural jails, so we could then work back towards circling back with the leadership teams within those jails, and then talk about the approach that currently is being done within Lander County and Esmeralda to help bridge those gaps and find some solutions. As well as now that's exactly what's happening with the implementation phase. The counties are willing to work on solutions with the state of Nevada, so a lot of success there. So out of 23 of our jails, 22 of the jails indicated that they would be willing participants and working with the state on finding solutions. And the vast majority of them were very transparent in saying that as long as it didn't come with an unfunded mandate. And this approach is not just throwing unfunded mandates towards the county jails. It's actually working side by side with our jail leadership, as well as other representation, to find some viable solutions, to include, if there is a cost associated with that solution, finding out whether or not there's a current available source that can help fund that effort, or if it's something that we have to strategically work on and build into, a budget in order to ensure that there's a bridge being developed to get across and close that gap. Next slide, please. So as we talked about, this whole purpose is to identify those gaps. So some of the gaps that have been commented on and presented during the research phase are presented here. So the lack of access to medical and mental health resources, that's probably the #1 issue for both the community as well as the jails. And then a lack of funding, of course, is associated, a direct driver of the lack of resources, as well as a lack of pharmacy access to MAP medications, buprenorphine, naltrexone, and methadone. And then a lack of discharge planning and reentry process for the jails, our small and rural jails, simply, a big gap that we're working towards solving with our pilot programs currently. Next slide, please. Now, here's some of the key takeaways and some of that aggregate information that I wanted to provide you. I won't read through all of this. However, I will just go over some key things that are concerning that we're, again, working on as a part of this approach. That very top one, 87% of our departments throughout the state do not have any type of a community deflection effort in motion. And again, it's simply because of the lack of access to care resources in the community. However, we feel as a multidisciplinary team, there's opportunity to find some solutions to help implement something that will drive some significant difference in this area. Only one jail in the state actually currently uses a telehealth type of an option. And that would indicate that there just hasn't been that much investigation or research conducted on telehealth types of services, which is demonstrating a great deal of success, specifically for those that are suffering from substance use disorder, as well as for communities in small and rural locations that don't have the resources accessible to them. And then the big part of the reason why we're here, is 91% of our jails throughout the state don't have a formal MAP program. And that's, something that we all know now that is required under the Americans with Disabilities Act. And we are going to work on providing that solution helping provide that solution for our jails that are participating. And just wanted to ensure I commented on this too. You'll see that the one jail doesn't have access to Narcan. That has since been addressed, and they have, based on what's been fed back to me, that they've actually found a source to implement Narcan within their facility. So we were able to solve that. Next slide, please. So we talked about the main three barriers: on-site medical and mental health resources, the lack of funding, lack of community resources, some other issues that are challenging for our jails. 70% of our jails do not have the resource in place to offer Medicaid enrollment. And in speaking with the Department of Health and Human Services and others that are have the main responsibility of Medicaid enrollment, we are working towards finding a solution to making it like a virtual type of process. So very early in discussions as far as like this possibility for a solution. However, very hopeful that we'll have something in place for these jails with inmates that are wanting to have themselves enrolled prior to being released from the facility. Next slide, please.
Hold on, Mr. Till, can we go back for a quick second?
Absolutely.
Yeah, at the bottom it says 20, you mentioned it earlier, but you reiterated here that 22 out of 23 are willing to work. Which jail is not willing to work with the state to develop a MOUD model?
And there's a reason for the jail that's not listed here, which would be Boulder City. Boulder City actually was looked at as a temporary holding facility. However, when I visited that site, they indicated to me that they no longer hold inmates within their temporary holding facility. Although they still have the structure in place, they transport all their inmates directly to the Henderson Detention Center. Okay. But the fact that they still had an operational facility, I kept them within this data just to demonstrate that all 23 jails participated, and we had responses from every single one of them. But they indicated that they wouldn't work with the state simply because they don't want to be looked at as actually housing inmates within their facility.
So how long on the average are inmates housed in Boulder City?
Based on the feedback that I received from the deputy chief that I toured the facility with, they don't have any inmates housed there at all. It's basically a walkthrough type of process where, as it was explained to me, that inmates that they arrest are taken into their custody. They actually walk them through a fingerprinting process in their facility, and then they're directly transported to the Henderson Detention Center.
Okay, all right, very good. Thank you for that explanation.
Yes, sir. So my recommendations for the group is to continue to be engaged with this process. It's still in its infancy phase, I would say, from a implementation start with Lander and Esmeralda. We have several other counties who are also working with us to want to have the similar type of an approach. And those facilities currently are Lincoln County, as well as Mesquite Police Department wants to have a similar approach, working on the same effort with Story County. Oh my goodness, I apologize. Lyon County, Pershing County, and I know there's one other there, but that's just a good indication that the leadership teams within the sheriff's departments and with Mesquite, the chief of police there, they're wanting to be progressive and they're wanting to uphold best practice standards within their operation. But I also commit to you that I will provide status updates appropriately, for the different SURG subcommittees, or however the chair and the committee directs me to. That's what I'm here for. I want to demonstrate that the effort is working, and I also want to be able to communicate when we need help and support based on the feedback that we're getting or things that are being identified that we need some greater support over. So with that, I think that's the end of my presentation. I appreciate everyone's time.
Okay, thank you, Mr. Till. Ms. Nadler, we'll get you in a second. A question for you, Mr. Till, though, and I don't know the time frame of your conversations and interviews with the counties, but last legislative session, we passed a bill that requires all jails and prisons to the extent funds are available, to implement Medicaid assisted treatment programs for those who are in the jails. Did you have conversation around implementation of that particular statute? And because you talked about financial resources, and I just wondered if there were any conversations had about complying with that particular law and whether financial resources have been made available for implementation of that based on monies they've received, for example, from opioid litigation.
Yeah, to answer your question, Mr. Chair, as far as like the specifics about the law that was passed, no, there was no specific conversation about that law that was passed. The intention of my approach was basically identifying those pain points and barriers to actually implementing an MAT program, okay, and then offering the support and helping, with this approach that was outlined in this presentation to help support them in actually getting it established. And so that's where, we've been fortunate to have, a good number of the counties want that help and guidance and working together as a multidisciplinary team to ensure that it's implemented. But as far as talking about funding sources that have been made available to the different counties, nothing specific was talked about, from a dollar amount standpoint or, what they have access to. However, I will say that some folks did seem as though they were puzzled about whether or not there were any type of funding sources that they could have access to actually implementing a MAP program. So with Esmeralda and Lander County, because there are pilot programs, we're navigating that space. With Lander County, we're a little bit more progressive than Esmeralda. We have our next meeting is scheduled for April 25th, and it's Intercept 2 of the sequential intercept model, which is basically at the time of intake or booking inside of the jail. So that's what triggers a lot of these different things that will begin that MAP programming process. So for at least for Lander and Esmeralda, funding sources have already been identified to implement a jail MOUD provider in those environments. And then we'll continue to, with this effort in those two counties, that will actually kind of like put the framework together for these other counties as we take the same approach with them. And I know I said a lot of information. I hope I was able to answer your questions specifically.
Yeah, no, listen, I appreciate that response. And by my comments, I'm going to ask that Dr. Kearns and Therese Benitez-Thompson note that I'd like to brainstorm on a way to inquire with the counties and their jails on funds received and appropriated toward compliance with that statute that we just passed. I am interested in understanding how much money these counties have received from the settlements and what they've done with it, and if the monies have been made available to the MAT programs that the statute requires them to implement to the extent funds are available. So that's not a question for you, Mr. Till. That's me thinking out loud so that Dr. Kearns and TBT know that I want to follow up on that. Thank you. Debbie, you had a question?
Thank you, Attorney General Ford. Thank you, Sheriff, for giving us that great presentation. And that was one of my questions I was going to ask, what's being implemented with the MAT. So thank you for asking that, Attorney General Ford. A question I have for you, is there a number or some kind of chart that y'all keep for the number of those who are in prison who have actually OD'd? And I don't mean passed away or passed away and or OD'd in prison. And I'm asking this because I meet several kids on the street, and I had one of my friends whose son was in jail and he watched somebody OD while he was in there. So like, is it increasing? Is there some kind of chart which shows us what is happening in the jails? And that's number one. And number two, Clark County, and I'm not sure how the jail systems work. Do we have more jails in Clark County than we do in Esmeralda or Nye or the other counties? I just want to make sure everybody's getting the help that they need in prison, because I see too many kids on the street who've been just gotten out of prison and are back on the streets and on their deathbeds, God forbid, but they are.
And thanks for your questions, Debbie. I'll work my way backward in answering them. So your first question in regards to the actual public records of those that are dying in custody from, if I heard you right, from all substance use disorders. I do believe, there are requirements, reporting requirements. I know from a jail standpoint, we were required to keep track of this data and then provide it at a state level as well as a county level. As far as like how it's accessible from a public standpoint, I don't have an answer for you there. So I apologize for that. However, I just wanted to reassure you that the data is tracked. It is monitored. I know that in my experience of being a bureau commander inside of the Clark County Detention Center, it was something that we analyzed often to work towards finding solutions to the gaps, meaning that we would take a critical review of every in-custody death that we had to include those that were deemed deaths from substance use disorder, and determine what could we do to mitigate that from happening again, and find solutions to increase the odds of someone getting the care needs that they required, to include bridging the gap to reentry with a discharge plan. I can't speak to you as far as like what happens in a prison environment. I'm less familiar with their method of tracking that type of information. I would like to think that from a discharge planning standpoint, that would have a similar process in place. And then your other question, I'm sorry, in regards to more jails in Clark County, yes. So Clark County includes Mesquite, Boulder City, Henderson, North Las Vegas, the city of Las Vegas, and the Clark County Detention Center. And then all of our other counties, they are single jails. However, they may house inmates within that are arrested within cities within the counties, but their numbers of jails would not equal those within Clark County.
Thank you. I appreciate it. And are we looking at a sooner than later time frame to get these implementations in the bigger counties where there's more people who are suffering from substance use too?
Well, I can share with you that both Washoe County and Clark County, they currently do have medicated assisted treatment programs inside of their facilities. In fact, they're pretty much leading the charge with medicated assisted treatment in large type of jails throughout the country. So I think you're in the state of Nevada for both Washoe and Clark, you'll find best practice programs that have been implemented.
Thank you, thank you.
Thanks, Mr. Teal.
ma'am.
Great responses there. Next question I see is from Mr. Schoen.
Thank you, Chairman Ford. Thank you for that presentation, Mr. Teal. Very much appreciate it in the overview, and especially the work that you're doing on expanding MOUD and MAT treatment. Those are a part of our priorities too for the Resilient 8 Formidable 14 coalitions across rural Nevada. First a comment and then a question for you. You had presented some data about the use of community health workers in the jails, and I don't know that it's entirely accurate in that my organization provides community health workers for both the Story County Jail as well as Mineral County. They are not jail personnel, they're actually our personnel, but they provide a fast response in working with inmates to develop care coordination plans for when they're discharged. And I believe Lyon County Human Services also uses a community health worker in the jail there in Yerington as well. But my question is this: I'm really excited to see the expansion, and I'm curious more from a mechanics perspective, if you will, in terms of how are you providing the prescriptions for medication-assisted treatment? Do you have a contract with medical providers for these rural jails, or how are you connecting them to somebody who can write that prescription? Because not all rural providers are yet on this train in terms of being convinced this is the way to go. So there's some work there to do to encourage medical providers to be more open to prescribing. So so back to that question, are you using a particular company? Do you have several different doctors who said, yes, we're interested in doing this, or some other solution?
Thank you, Mr. Schoen, and appreciate your comment. And with that, I will circle back and ensure, that I'm looking at my data and making sure that it's accurate. So, because I don't want to, mislead anybody, and I don't want to take away the credit that you and others deserve with the implementation of community health workers within those different counties that you mentioned. So appreciate your effort there. As far as the prescriptions for medicated opioid use disorder and the programs that are being implemented with Esmeralda and Lander County, it looks as though we've identified a service provider who will actually be making the assessments, and they are OTP accredited, so they're able to provide the prescriptions. But this still will remain a challenge moving forward in the different counties. So it's a part of one of the pain points and the barriers, and the bridge will be to identify those service providers who are willing to provide the programming inside of the jail, to include, if we have to look at we've looked into different considerations, just throwing things on the wall to see what sticks as we think further into the future. We're talking about, if we don't have those types of options within the community itself, can we do more of a regional type of an option? Could we also do a mobile option? As well as, what type of telehealth abilities would we have in standing up a MAT program inside of a jail? And then the second piece of this is the pharmacy side. Yeah. So I know that looking at Esmeralda and knowing that they don't have a pharmacy there locally, their closest pharmacy is in Tonopah, and recently was able to find out that pharmacy is a Rayleigh's. And we actually have a meeting next week to talk with Rayleigh's about this effort that we're working on, and whether or not there's the ability to expand MAT medications within their pharmacy. It's a big ask, but it starts with a discussion. So that's it's progress. The ability to introduce this idea to them and then being willing to talk is fantastic, and that's the best first step that we could ask for. So hopefully that's giving you at least some optimism that we understand that this is a big part of the challenge, but collectively we're going to work together to find the solutions.
And Bill, I appreciate that. I will reach out to you via your email, because we are actually actively reaching out to rural providers to see if they would have an interest in providing MAT assisted treatment. So I think we could probably work together to hopefully expand capacity.
Oh, fantastic. I look forward to it.
Let me follow up with that, Aaron Ford, for the record. I know, for example, in the state prison system, the prison system can log into a prescription provider or a drug provider and get drugs that are needed for treatment of patients for whatever rationale or issue that they have there. I don't want to be comparing apples to oranges, and I may be, and you can let me know that, but is that not an option available to rural counties and their jails? Can't they use a comparable system where they log into a Acme, I don't want to use particular companies, but Acme prescription or Acme pharmacy, and then order and have medicated assisted treatment drugs mailed to the facilities?
Well, taking and Beth Slamowitz might be a better person to answer this question, but just my understanding of like methadone and methadone still being federally regulated, I don't believe it's a drug that can be mailed to an individual in the community. So that's one of our challenges. And I just think that there's some regulations and being able to mail these type of prescriptions through the mail. I think you actually have to have a courier type of a service in order to have these delivered appropriately.
Okay. Well, even a courier system. I mean, I don't know if the drugs that are ordered online by the prison system are all mailed. I mean, I just use mailed as a delivery method, but there are ways to get prescriptions online, and I just wondered if those, if there has been any effort to duplicate what the state prison system does to get medications that are needed for its prisoners or its offenders, to have it operate comparably for the offenders who are in our jails in our counties. And maybe you can,
Mr. Chair, you definitely raise a good point. You know, if this is something that our state prison system is already successful in implementing, then it's absolutely worth a conversation to see whether or not they're able to be successful in having inmates continue with these prescriptions in the community that are related to MAT. So I would absolutely make contact with, I've been in touch with the director of pharmacy at the NDOC. So I'd love to circle back with her and have that conversation with her, but I appreciate you making that point.
Yeah.
I don't have an answer for you as far as like it being talked about for the county jail, but if this proves to be a viable solution, then it will absolutely be a part of our discussion moving forward.
Yeah, and I'd be surprised if no one has thought of this already. I may just be coming up with something that people have already rejected and looked into and see that we can't do it. But it'd be great to hear from you, Mr. Till, and based on what you find out, okay?
Thanks, sir.
Thank you. Any further questions from the committee members?
We have questions in Vegas.
Okay, state your name, please, and ask your question.
Hi, Jessica Johnson for the record. Captain Teal, great to see you online today. Thanks for a robust presentation. I was really excited to hear that you and my committee member, Mr. Schoen, brought up pharmacy and pharmacy access. And glad to hear that you're thinking about this as you're evaluating kind of that linkage to care and pharmacy access within that network. At least down here in Las Vegas, from some of the programs I'm familiar with, there's been a barrier of ability to fill prescriptions at pharmacies, with pharmacies not carrying medication that folks need. There's also been a barrier with folks being able to fill after discharge within the time frame that this prescriptions are written, sometimes for 3 days, and in the time of getting released to get access at the pharmacy, just some complications arise with that. So I'm requesting, and I guess hopeful, as you're thinking about that kind of full person care and thinking through the linkage components, that you'll consider those indicators as you're thinking through that evaluation. Thank you.
Thank you, Jessica. Your points are taken, and it's great to see you as well. I'll absolutely ensure I jot that down and have that as part of our focus.
Thanks so much, Jessica. Further questions? Okay. Hearing, seeing none, Mr. Till, it is heartwarming to know that you're working in this area, and thank you so much for putting your quarter of a century's experience into this very important work. Thank you for it, and we look forward to continuing our conversation with you.
Thank you, Mr. Chair.
Okay. All right. Sorry, moving on, we will go to agenda item number 6, which is a report of expenditure of funds from the Fund for Resilient Nevada. We are going to have Vanessa Diaz, a quality assurance specialist from the Department of Health and Human Services, and the director of the Office for Fund of Resilient Nevada to give us that presentation.
Hello, everyone. I'm Vanessa Diaz. It's a pleasure to be with you all today. I'll start off with giving you guys a little bit of a background. The Fund for a Resilient Nevada was established in 2021, in which one of the responsibilities of DHHS was to create a statewide needs assessment plan to drive funding allocations. This was completed in July 2022 and finalized in December of 2022. The NRS established the Advisory Committee for a Resilient Nevada to identify and prioritize recommendations to the Director's Office by June 30th every even number year. This year, the ACRN will be submitting updated recommendations and priorities. Moving on, next slide, please. Thank you. A report regarding findings, recommendations, and expenditures is due to or on before January 31st of each year to the following: the Governor, the Director of the Legislative Council Bureau for transmittal to, in odd number years, the next regular session legislature. In even numbered years, the Joint Interim Standing Committee on Health and Human Services and the Interim Finance Committee, the Commission, each Regional Behavioral Health Policy Board, created by NRS 433.429, the Office of the Attorney General, and any other committees or commissions the Director of the Department deems appropriate. Next slide, please. So this is a depiction of the opioid fund mapping that we were working on. Highlighted are those that we last reported on, but we are currently updating these as well. Funding of the OD2A local SNHD covers linkage to care, harm reduction, stigma reduction, clinical education, and local community drug surveillance efforts. So this is a small depiction of what we've been able to map so far. Next slide, please. As a reminder, the budget for Fund for Resilient Nevada is over an 18-year period, and the use of these funds needs to be approved during the biennial legislative session or by the Interim Finance Committee. On the next several slides, we have identified the activities within each goal that we are either currently funding or are doing internally. We have additional activities on the statewide plan that are not yet currently being funded, but we are working with the advisory committee to prioritize those items at this time. So as you can see, we have goals 1 through 7 listed, and I'll go ahead and start with goal 1. Goal 1 is to ensure local programs have the capacity to implement recommendations effectively and sustainably. Here, what you see on the screen are some of the funded activities. These are some of the organizations that we're currently funding through the OTAC, which is the Opioid Technical Assistance and Coordination Center. We've been able to start a program that implements a statewide center of excellence that will develop and disseminate evidence-based and research-informed training and offer technical assistance to address opioid use, misuse, abuse, and overdose affecting Nevada communities. So they are able to work on a lot of these funded activities on screen. This program actually began in January of this year. As for convening statewide pharmacist roundtable events, we've done that through Nevada Public Health Foundation. This was done up in October of last year, and it was known as the Summit on Addressing the Opioid Epidemic through Collaborating Across the Continuum of Care. Next slide, please. Continuing on with goal 1, some of the funded activities the OTAC is taking care of as well through this program. They're training on EVPs or evidence-based plans and practices and evidence-informed services and projects during implementation, providing ongoing training as needed and offering technical assistance while monitoring the implementation. Next slide. In this slide, you will see some of the things listed here that are goals that we are currently working on within our unit. These are internal and ongoing. Some of the things that we're working on are developing quality assurance activities that can braid across organizations, monitoring corrective action plans, evaluation and mapping of current funded opioid and substance use disorder projects. So these are just a few that are currently just ongoing within our unit and we're consistently working on within our team. Next slide, please. Goal 2 is to prevent the misuse of opioids. Some of these funded activities, we have several different organizations that are able to help us achieve these activities here. So identifying substances involved in overdoses quickly. We've been able to do this through the Nevada Department of Emergency Management, in which 17 mass spectrometers have been purchased, and they will be distributed to the counties across Nevada, along with training on how to use the spectrometers. We have received an update today that training for Elko, White Pine, and Eureka went well, and all agencies were on board and very appreciative of the training and equipment being provided to them. These units have been, we have asked and made sure that these have been given for the purpose of public and LE safety, and not for the purpose of incarceration. So a lot of these counties are very ecstatic that they would have the means to protect their own from illicit drug exposures, and they have scheduled more trainings for the remaining counties as well. Educating the public on the identification of treatment needs and treatment access and resources. This is currently being funded through the NIE Communities Coalition, which provides opioid and adverse childhood experience awareness, education, screening, and linkages for youth aged 18 to 24. Promoting available resources are also being done through NIE Communities Coalition and Quest Counseling. To give you an overview of what Quest provides, they provide immediate resources and care to youth through age 24 after they're admitted to area hospitals for opioid-related misuse or overdose, as well as they offer a continuum of care following hospital discharge. For the rest of the resources, we've been able to do this through the Nevada Public Foundation. Next slide, please. Continuing on to goal 2, we've been able to fund the Boys and Girls Club for increasing access to aftercare, summer, and intramural programs. This includes it's a statewide program, and it's including 6 organizations and 34 locations. And some of these locations are in different environments, such as like apartment complexes and other facilities. Increasing prevention in schools has been done through UNR and multi-tiered systems of support, the MTSS, and it's addressing the opioid crisis through prevention and intervention by focusing on improvements in school climate, the infrastructure for community services in schools, and integrating specific drug prevention and treatment practices into the Nevada multi-tiered systems of support. Implementing ages 0 to 3 programming to support families impacted by substance use. This is being done through one of the programs that we're funding through UNR, the Empower program, which is a very powerful, awesome program that we've been happy to fund. This is a recovery-oriented, family-based program. They provide medication for opioid use disorder and wraparound services. They also use a stage-based approach from pregnancy 0 to 12 and 12 to 24 months postpartum. Just to let everyone know, I am giving you a bit of information on some of these awardees, because in the next few slides, we'll also be seeing the awards that have been gone out. So I want to make sure I do my due diligence by letting you know their scopes of work. Next slide, please. These are some of the internal and ongoing things that we are creating at the moment, providing school survey results on drug trends, issues to school leaders, and determining necessary action to reduce the risk of overdose in Nevada communities. Next slide, please. Thank you. Goal 3 is to reduce harm related to opioid use. These are the funded activities at the moment. First one, expanding the availability of harm reduction products and vending machines. This is being done through Track B. Based on the January quarterly report, Track B has provided 116,840 syringes. And this has been able to Mr. Rick has been able to accomplish this through several different methods of distribution, including mail order, storefront, vending machines, and through street outreach. An updated quarterly report will be submitted this month that will reflect distribution numbers through the life of the award thus far. For the next point, including people in recovery and those with lived experience in opioid use and planning efforts. We have Empower, who's taking care of that as well, and Carson City Community Counseling Center. A little bit of what Carson City is doing. They provide high-intensity residential treatment for people within the criminal justice system and public safety systems impacted by opioid use. We can move on to the next slide now. Thank you. This is goal 4. Goal 4 is to provide behavioral health treatment. These are some of the funded activities. So improving upon evidence-based SUD and OUD treatment, we're doing that through OTAC. The use of EBPs to support mothers, babies, and families. This is being done through Empower. Continue to work with tribal communities to meet their needs for prevention, harm reduction, and treatment. That is being funded through the Nevada Indian Commission. We're currently funding a position in the Nevada Indian Commission to be able to guide this and lead the way in this program. For increasing longer-term and short-term rehabilitation programs, we have Living Free Health and Fitness. Living Free provides evidence-based services to frontier area residents with opioid and co-occurring substance use and mental health disorders. At the moment, we're currently funding an additional 8 beds with Living Free. Washoe County DASTAR program. Through the Washoe County DASTAR program, they focus on expanding services for criminal justice involved persons with opioid use disorder who are leaving incarceration on probation or pretrial supervision. Some of these services include providing coverage of costs for participants that lose Medicaid eligibility and providing recovery housing as well as transportation assistance. Another one that I want to highlight is implementing a plan for expansion of mobile MOUD treatment for rural and frontier communities. We're able to accomplish this through CASAT, in which 3 mobile recovery units have been purchased and will be distributed to 3 qualified organizations. And that is still undergoing, so they have not announced who the 3 qualified organizations are. We can move on to the next slide. Thank you. This is a continuation of goal 4 and how we are funding the activities here. We're helping fund developing sober and affordable housing through Living Free and Washoe DASTAR program. Empower is helping us with continuing to monitor and expand ASTHO programs for neonatal abstinence syndrome with special attention to preventing health disparities. And OTAC is helping us with creating a provider forum for treatment and other resource sharing. We can move on to the next slide. These are internal and ongoing that is going on with us in our unit. We're taking care of currently on goal 4. So some of these include requiring all SUD treatment programs to measure standard patient outcomes and implement best practices. Ensuring funding for the array of OUD services for uninsured, underinsured, and tribal populations. So these are just a few of the things that we're able to do internally and we're working on as an ongoing goal. We can move on. Thank you. Goal 5 is to implement recovery communities across Nevada, social determinants of health. Some of the activities that are being funded right now are developing employment supports for those in treatment and in recovery. This is being done through Living Free Health and Fitness. A part of their program is that they have a cafe and a gym that are operating as actual businesses, and they are hiring their program participants to work in these establishments. This is a great accomplishment and has seen great success. We can move on, thank you. These are internal and ongoing that we are working on as well. We're establishing policies and funding to support evidence-based recovery housing. These are things we're working on as a team and with our partners. We can move on. Goal 6, to provide opioid prevention and treatment consistently across the criminal justice and public safety systems. Funded activities including providing MAT in all adult correctional and juvenile justice facilities. I do want to note that it's not currently being funded in all adult correctional facilities, but we are well on our way there, and that is the ultimate goal. We are doing this through Carson City Community Counseling Center. Connecting people leaving jails and prisons to post-release treatment, housing, and other supports, as well as educate about overdose risks. Also doing that in Carson City Community Counseling Center. Internal and ongoing efforts, expanding drug court treatment availability, monitoring outcomes related to SUD treatment for the criminal justice involved population, and educating parole and probation officers on the need for treatment, recovery, housing, and employment. This is internal and ongoing, and we are achieving this through Bill Teal's efforts, as we've been able to hear earlier today. We have some pilot programs that are set to start soon in the 2 counties mentioned by Mr. Teal. We can move on. Thank you. Goal 7, to provide high quality and robust data and accessible timely reporting. Some of the funding activities, collecting data from the Poison Control Hotline. This is being done through the Public Health Preparedness Program. Implementing the All Payer Claims Database, being done through the Division of Healthcare Financing and Policy, and creating an automated program interface connection to emergency medical services. DPBH Emergency Medical Services is able to do that. We can move on to the next one. Some of the internal and ongoing efforts that we have are standardizing reporting, establishing minimum data sets for suspected and actual overdose for use, and ensure data elements include demographic characteristics. We've recently hired Natalie Gladys from the Office of Analytics, who is working on creating a data pipeline for our funded programs that can be used to assess progress on FRN goals and their programs. She is also developing a FRN dashboard that will display progress made to achieve the 7 goals listed in our statewide plan, as well as the financial information of how funds have been dispersed to programs across Nevada. Natalie also hopes to create a dashboard that illustrates through data the combined progress of FRN, the SOAR grant, and other grants to quantify the opioid abatement statewide. These dashboards will be made available to the public for transparency and informational purposes. We can move on to the next one. Thank you. And these are our list of our awardees, some of which I have mentioned today. The way we have identified providers to fund are through master service agreements, through notice of funding opportunities, budget allocations, expansions of existing scopes of work, and sole sources. In order to be a funded project, a project needs to be in the statewide plan and identified as a priority within the department. We can move on to the next slide. And this here is just a continuation of some of the awards that have been sent out. I did want to let everyone know that we are expecting to release a NOFO ballpark May or June. And we are going to have a request for proposals in order for people to apply to some of the goals that they're able to assist us with, and submit a proposal for which goal they are able to meet. And that will be happening soon. So we're working on that currently. We can go to the next slide. The One Nevada Agreement reporting calendar year. So all of the One Nevada signatories completed reporting requirements for calendar year 2023. Highlighted are the ones Nevada signatories that reported no expenditures. We are currently working on a way to make the report public so you can see reported expenditures and intended uses. This is just our local needs assessments and plans. The completed ones are Humboldt, Lyon, Washoe, Esmeralda, Mineral, Douglas, and Nye, and anticipated to be completed by early May are Churchill, Pershing, Story, Lander, and Carson City. Other than that, that will be my presentation and update for you all. Do we have any questions?
I do. Can you go back a couple slides to those municipalities that have, yeah, right there. You say the ones that are highlighted have reported no expenditures?
Yes.
And some of them on the next screen haven't done, go forward one screen for me. Is this the same list? Essentially, folks who have not done needs assessments have not done expenditures, or are there, is there a difference between these 2 lists?
There is a difference between the 2 lists. I can't necessarily fully be able to explain it all to you, Attorney General Board. But yes, Churchill, Pershing, Story, and Lander, Carson City have not completed a needs assessment, but we are in discussion with them.
Okay, so go back one more screen for me. in your discussions with these folks who are highlighted, have you gotten any indication as to why they've expended no monies?
At the moment, I am not sure about that, but I can have Don Yohe follow up with you about it, and I'll take note of this question.
Yeah, I'd like to know that. Is one of the prerequisites to spending money that you have a needs assessment done?
No.
Okay. Okay. I'd like to know if there are rationales or reasons set forth by these entities as to why they've spent no money. So you can ask Don to help me with that one. And then on the screen, moving ahead, one more, we'll go to 45 now. I would also like to know what the holdup is with these counties getting needs assessments done.
Yes, absolutely. We have tried to contact a few of these counties as well, but I will be sure to update you on the reason behind that.
And then the third point is if you could also kind of correlate that with how much money they have received under the One Nevada agreement. If you don't know that, I can get Mark to give me that. But if you happen to have that number handy, that'd be helpful as I look at this chart of folks who have not done these assessments, those who have done it but still haven't spent money, and how much money they've received that's just sitting there waiting to be spent.
At the moment, I don't have those numbers handy, but I'll be sure to get that to you, Attorney.
Very good. Thank you so much. I see Dorothy Edwards' hand up. Go ahead, Dorothy.
Hi, thank you, General. This is Dorothy Edwards for the record. I think it was goal 4, you mentioned you were working on enforcement of parity for mental and or for behavioral health and physical health, I guess. If you have time, not to get into too much of the weeds, but how are you doing this? And the reason that I ask is I facilitate the Washoe Regional Behavioral Health Policy Board, and of course, we're beginning to discuss BDRs. And we had a presentation by the Board of Psychology on parity. I won't get into the weeds of that either, but just was curious as to how are you working on enforcement? Did I say, yeah, enforce parity across what does that look like?
Sure. So at the current moment, I will definitely have Dawn reach out to you with that. I'm taking note of these questions.
No worries.
So I can't answer that at the moment. Thank you.
Awesome.
I appreciate it.
No, thank you so much. And I'll reach out to her as well. I appreciate it.
Thanks, Dorothy. Any other questions?
We have a question here in Vegas.
Okay, go ahead.
Hi. Sorry, Attorney General Board. Hi, Jessica Johnson for the record. Thank you, Ms. Diaz, for a great presentation. I was wondering, in goal 1, you mentioned some of the specific programs. The one I took note of was the great work of our colleagues out at NIE Communities Coalition doing some of their prevention work. And I was wondering if you could speak to, are those programs sort of just within their jurisdiction? Or are they more statewide, or does it kind of depend on the entity?
So I think the current award that we have with NIE is within their county.
Okay.
Yes.
All right. Okay, that's helpful. Thank you.
This is Shayla Holmes in Carson City with a question.
Sure.
Go ahead, Shayla.
I guess, Vanessa, I just wanted to get clarification or make sure that I understood correctly in regards to the needs assessments that you're speaking of are only required for counties to complete if they were interested in accessing Fund for Resilient Nevada funds, that counties expending their One Nevada agreement direct allocations were not required to produce a needs assessment. Is that, I just want to get clarification on that and make sure that that might have some solution or answer as to what's going on between those two slides.
That sounds correct. So for Fund for Resilient Nevada, we do require, if they want to receive funds and apply for some funds, we do require a needs assessment from these counties. And when it comes to One Nevada agreement, they are not required to do so. that answers your question, but it's correct.
Okay, that is helpful. Maybe you can tell me which of the participants of the One Nevada agreement have applied for funds from the Fund for Resilient Nevada. That's the question for Don, so be it, but I would like to know that as well.
Yes, at the current moment, that's something that Don would have to answer, Attorney General Board.
Yeah, that's fine. Okay.
Thank you.
Okay. I had a question. I noticed that you had given 150K, I think it was, to an entity working on fentanyl test strips, or distributing the fentanyl test strips. I may want to I'm putting this out so you can remind me so I don't forget. I was just yesterday speaking with an individual who knows of a company looking to partner with the state to distribute fentanyl test strips on a very broad basis. And so TBT, Dr. Kearns, please help me remember to coordinate with the state and or some municipalities about this company that I just got introduced to. I actually have one of the packets right here. I'm not going to put it on the screen because I don't want to talk about the company name until I get more information, but that is an opportunity that came across my desk just yesterday. Okay, any further questions?
And just to let you know, Attorney General Board, I actually had a team member let me know that Lyon County was the only county that let us, that was applied for funds for Fund for Resilient Nevada. So only one county.
Okay, all right. Thank you so much for that response. All right, well, thank you so much, Ms. Just for your presentation has been very helpful. And we have this PowerPoint as part of our record for those who want to take a look at that. I know there have been a lot of questions over the course of the last year or so about how this money has been spent at the state level. Those questions are oftentimes directed at the SURG committee or at my office. And as we've indicated, we don't get a say in that. I mean, we don't make those decisions, I should say. And you have demonstrated through this presentation how some of that money has been spent. And so thank you so much for that. And I encourage and commend to the reading of anyone else interested in that particular type of question to take a look at this PowerPoint and follow up with DHHS with additional questions. Okay, moving on then to the next agenda item. It is number 7, SURG tracker for selected items under the Joint Interim Standing Committee on Health and Human Services. This is information and discussion, and Laura Hale, mic's yours.
Thank you, Chair Ford. Can you hear me okay?
Yes.
So the Joint Interim Standing Committee on Health and Human Services has been meeting this spring, and we're just trying to track for SURG members some items that might be of possible interest. And first, I want to just have people take a look. Crystal, do you have that document that you can put on the screen?
I'll get it up in just a second.
Thank you. There's a footnote on that just describes for people how to follow the meetings of the Interim Health Committee or other committees if you're interested, but you're actually able to link to the meetings. So you see that footnote, you're actually able to link to the meetings on the legislative website, and you can follow the agenda items and go directly to specific agenda items if you want to hear recordings of items of interest. So just wanted to let people know there's a way to do that. And you know, if you have questions when you're trying to do that and you want to reach out to me or other SEI people can probably help you as well. So I don't want to go over each one of the items that are on that list, but I did want to highlight a few things. So at the March 11th meeting, the one thing that I thought might be of interest is that there are regulations that they're looking, you know, potential BDRs to clean up and simplify continuing medical education requirements. And some of those relate to misuse or abuse of controlled substances, pain management, or addiction. So if you want more information, you can go back and listen to that particular hearing. And February 16th, there were quite a number of issues that related to substance use response. And the first one particularly, there were public comments related to this regulation on the provision of medication-assisted treatment. And in particular, the vice chair, Orrin Licker, did reference that he supports very much expansion of using pharmacists to provide that treatment, particularly with the current shortages of healthcare professionals. So again, that's something that you could go back and listen to the details. Under access to healthcare workforce, increasing integration of community health workers. I know the SURG members have had quite an interest in utilizing community health workers to serve as liaisons between providers and the communities they serve. And then down a couple more bullets, substance use prevention, harm reduction, treatment and recovery. That was a specific presentation there. Again, you could go and listen to that one. This was under the Silver State Health Improvement Plan that's with University of Nevada, Reno School of Public Health. So a lot of these things reflect what the SURG has put forward as recommendations and what some of the things that Vanessa just presented for the FRN. So there's a lot going on there. And if you want to drill down, you can. If you have questions that we can help with, again, you can reach out to me. I think most of you have my email, or you can reach out to any of the other SEI staff so that we can help provide information. And we'll continue. There was just a meeting yesterday of that committee, the interim committee, but it was really kind of broader issues. Sometimes the broader issues will have impact, whether it's about healthcare workforce type items or whether it's about budgetary issues. With one of the things was Director Whitley had presented on that February meeting, talking about a funding cliff and a services cliff coming, and that just has to do with some of the COVID funding that's gone away, and so of course that affects all sorts of things downstream. And again, you can go and listen to details, but we will continue to tune in as they have these meetings and try to identify particular items of interest. And you don't necessarily have to listen to the whole meeting or go on, the day of. You can go back afterward and get the recording. And as I said, you can look at specific agenda items to find out what might be of interest to you. And those agenda items are actually linked to the video recording so that you can cut right to a particular item as you like. And I'd be happy to try to answer any questions about that if you like.
Thank you so much. Any questions?
A comment down here in Las Vegas, Attorney General Ford. Hi, Jessica Johnson for the record. Ms. Hale, thank you for summarizing, sort of keeping us abreast of what's happening on the Interim Standing Committee on Health and Human Services. I also just wanted to bring up, and I don't know if this is sort of beyond the scope of the SURG and maybe thinks about, is connected to other issues, but it was brought up at Interim Health around sort of the connection, like the syndemic issue around opioid substance use and overdose with other areas like sexually transmitted infections, specifically congenital syphilis and other infectious diseases that might sort of be increasing in conjunction with or in a syndemic response with opioids and overdose. So I did note that kind of as one area as we're thinking about this comprehensive approach and kind of whole person care in our recommendations. So just wanted to offer that informational component as well. Thank you.
Thanks, Jessica. That's good information to know. Any other comments or questions? Okay. So let's do this. Let's take a few minutes break. Let's come back at 3:35 and pick up from there, everybody. See you in a little bit. All right, welcome back, everybody. We will pick up where we left off, and that's at agenda item number 8, the annual survey results from our SURG members. Ms. Rodriguez, can you lead us through this?
Yes, thanks, Chair Ford. Emma Rodriguez for the record. So similar to last year, a survey was distributed to all SURG members. It was open for a couple of weeks in March. We received 9 responses. And I wanted to note the full responses are available to be downloaded from the SURG website. And I'm just going to briefly summarize the responses to the questions on the following slides. So the first question was what worked well in 2023. We heard from quite a few folks that they liked the presentations from subject matter experts. There was good communication and collaboration. They liked the process, especially how the SURG went about presenting recommendations and then voting on them. And then our next question was on what could be improved. So there was responses related to the structure and focus of the subcommittee, a suggestion to really have all SURG members participating, speaking, and contribute rather than just a handful. Someone noted the need to have everybody present at the start of the meeting for quorum purposes. Of course, the Slido ranking process, the technical difficulties. And then there was a remark about how the SURG should handle recommendations that do not get ranked. We had a question related to the distribution of the annual report, but and you can see the responses. These are just the suggestions from the January SURG meeting. And then if you go to the next slide, Crystal, we received some responses from folks from where they shared the report. One person shared it at the Nevada Sheriffs and Chiefs Association at their quarterly meeting. And we also heard that DPBH shared the report via email. And you can see on the screen some additional suggestions for distribution of the annual report. I did want to note that agenda item number 10 is related to the SURG annual report distribution. So if it's all right with you, Chair, I'll just keep going and we can have would it work to have further discussion on that in the next agenda item?
Yeah, that's perfect.
Okay. Great. So we had a question related to choice point thinking and racial and health equity. We had a presentation, I believe it was the January SURG meeting from the Office of Minority Health and Equity related to choice point thinking. But the SURG hadn't made a determination about whether or not the SURG should adopt that process or continue with the current process of evaluating recommendations, how they impact racial and health equity. So you can see we received some mixed responses, but overall, based on the limited responses we did receive, it sounded like the SURG members were okay with continuing the process of evaluating how recommendations advance racial and health equity, and that's using both a ranking from 1 to 3 and then also narratively describing each recommendation's impact, and those are included in the annual report. But you will see there were also responses for a request to discuss further. Some people want more information or weren't sure. So I'm not sure, Chair, if you want to have that discussion now or hold that for later.
Yeah, why don't we agendize that for the next meeting?
Okay.
Yeah.
All right. So then there was also a question related to the LAPA 2023 State of the State's Legislative Roadmap for Reducing Overdose Deaths. There were 4 strategies that were identified in that report that Nevada has not adopted. And so there was a question on the survey just saying, do you agree that Nevada is not currently implementing the strategies above? And if so, should Nevada try to implement them? And then I'll just quickly go over the responses to each of those 4 strategies. So strategy 5 was on requiring state and local correctional settings to provide withdrawal management services. You can see the responses. there was support and agreement for it, but a note that some jurisdictions do support withdrawal management in correctional settings, and aware of work being done. And someone said they thought this was proposed during the last legislative session. The next strategy was strategy 7. That was to require all public high schools to store naloxone on site for responding to overdoses at school and at school-sponsored events. Someone said that they were under the impression that all public high schools have naloxone on site and asked to get clarification on that. And there was also a note that there could be a barrier to mandating this to schools because of the cost. So if there is an opportunity to address this ongoing cost, then it's a good idea to proceed with this strategy. Strategy 8 was on increasing access to substance use treatment in emergency department settings, with a note that some EDs do take home buprenorphine, and another person thought that there are some efforts around this as well, and thinks Nevada should do it, and recommended a presentation from National Bridge. And then finally, strategy 10 was on supporting information sharing with overdose fatality review teams. And there is agreement on that. And this a note that the state ODTA group did a report on this. And there's a link in the PowerPoint, and as well as a recommendation that the SURG review this report to see if there are any actionable steps to implement this strategy. So on the next slide, there's just some additional comments that you can read through. But basically the comments said that there's general agreement that Nevada should work towards implementing all of these, but also an acknowledgement that we need to look at what's already being done and how that's working. So then there was one final related question to the survey, just if you can go to the next slide, please, Crystal, on if the SURG had any suggestions for how the SURG should go about developing recommendations to address the LAPA strategies. So you can see they're summarized there. One person thought that those 4 strategies should be addressed using opioid settlement funds only. There were quite a few suggestions to have presentations related to these strategies, and you can see there were some specific suggestions related to the State Department of Education, as well as the one from National Bridge. There were responses related to the need for collaboration, and as well as specifically on possible BDRs or collaboration with other groups. And then a couple just other comments about the need to bring these back up as policy recommendations are being considered, and a note to put a focus on the mental aspect. And then I think there was just one final question. Yep, that's the last slide. So there was just a general question at the end for any additional comments or feedback. We had a response, just a kind of a question: how do we make an impact on our youth? And noting that prevention is key. Thanks to the support team for coordination, and then a suggestion to have a presentation on Oregon's current status on decriminalization and the subsequent recriminalization of drugs. So again, if you want to read through the full detailed responses, please go to the SURG website. But I think that's it for my summary.
Thank you for your summary. Questions, comments, concerns, complaints from the committee? I see Debbie's hand up. Go ahead, Debbie.
Okay, I'm going to try to get this clear. Thank you. Do you, as far as mandating Narcan in the schools, the bill, it's just a matter of verbiage. I believe I brought this up last year too. The verbiage in the bill, it does not mandate it. It says may, not shall. It's just that one word. And that's why it's not happening in the schools, because I had talked to Clark County CCSD. It was either last year or the year before, and they even pointed that out to me. So I know some of the schools are not doing it, at least here in Clark County. I don't live up north, but I just kind of keep track of what's going on down here. So it's one verbiage in that bill that was drafted that needs to be changed.
All right,
If that
thanks for
makes sense. Yeah.
Yeah, it was, thank you. Other comments, questions? Okay. All right. Well, listen, thank you so much for the presentation. We will go on then to agenda item number 9, potential surge expansion and proposed new members. This is something that has come up a few times, and I think the idea is to, I guess, take a vote on whether we want to expand to the proposed categories that are listed here. So as indicated before, the statute that created our committee designated specific members to serve on the SURG committee, and other members are appointed by my office, DHHS, the State Senate, and the Assembly. There are several categories of folks who have been proposed to be added to this committee, and the document provides details and justifications for the following proposed categories. A member of the general public. For example, we've lost a very important contributor who left her job, but would nonetheless be a very good contributor, I believe. And so that raised the question of whether we should offer an opportunity for a member of the public, general public, to be added. Whether we should include fire and EMS, a representative from that group, a representative from foster care or family services, a representative from the DA's Association. We have someone who is attending but can't participate, and that's at the request of the DA's Association. And so the question is whether we want to add them to the committee. And soon after that came in, a request to add a public defender designee came in, I guess, to kind of quote unquote keep it balanced. And so at the end of the day, these are the 5 suggestions that I know of that have come in. And what's the next slide? Is there something further on this? What's the next slide on this one? Okay, let's go back then. Okay, I didn't know if there was something else. So the question becomes: do we want to, do you want me to reserve a BDR of the 20 that I have to propose an expansion of our SURG committee membership to include these 5 categories? So before I entertain a motion, why don't we have any additional discussion that needs to be had? We've talked about this a couple of times over a few meetings, and so maybe we just need a motion, but any comments about this?
A comment down in Las Vegas.
All right, go ahead.
Hi, everyone. Jessica Johnson. For the record, you're probably tired of hearing from me by now, but I just want to say I think I was the person at the last meeting who requested some more justification behind these recommendations, just so we, kind of weren't adding in perpetuity a very long list. And just wanted to thank the folks who prepared the justifications for the committee. I reviewed them in advance of this meeting and was grateful for that. So thank you to everyone who contributed to that.
Thanks, Jessica. Other comments, questions, concerns, complaints? Okay, hearing none, then I will entertain a motion one way or another on whether we should expand our committee to new members. Either a motion
Jeff
to do so.
Iverson,
Go ahead,
for the
Jeff.
record,
Yes.
I would definitely make a motion to move this forward.
Okay. There's a motion. Do we have a second?
Debbie Nadler, for the record, I second that motion.
All right. Any further discussion on the motion? Okay. So moving and properly seconded that we reserve a BDR from my office to request an expansion of our SURG committee to include these 5 categories. With the discussion having been completed, all in favor say aye.
Aye.
Aye. Aye.
Aye.
Any opposed say nay.
Aye.
Any abstentions? Okay, the ayes have it unanimously. Thanks so much, everybody. Appreciate your consideration of this, and I will, by this comment, ask TBT and Terry to remind me to reserve a BDR to effectuate this particular request to the legislature next session. All right, moving on to agenda item number 10, SURG Committee Annual Report Distribution. Is there another slide for this? Very good. All right, there has been conversation or reports back to us about the annual reports distribution. The suggestions from the January meeting and the survey were here bullet pointed, and I do know that some of these have been already submitted. But absent some strenuous objection, it seems to me that if people, if entities on these bullet points have not yet received a copy of the report, then I will take it upon myself to again put the TBT and Dr. Kearns a task of a cover letter accompanying our report to go out to these entities.
Chair, can I just add that I have been requested to present on the annual report and the recommendations to a number of committees and boards. And the feedback I have gotten has been good from them. As would be expected, some of our recommendations created some debate between the members on some, like the prevention dollar increase. With the debate between those who work in the prevention arena versus the harm reductionist. But I think we were already aware of that. Also, I had a representative from one of the boards say that if we had BDRs that needed to go forward, not that this legislator agreed with all of them, but we could approach them about possibly being a BDR that would be sponsored by them from one of the behavioral health boards.
Okay.
So that was awesome. And then also, I had an opportunity to speak with Sarah Dearborn about the 1115 waiver. And she mentioned that amendments would have to be made to look at those rates and the rate increases. So that was something that I advised her that the SURG made the recommendation for a BDR. So that supports what they are already doing. So it's been positive feedback. And I think the ability to get this out to more groups at the WISE recommendation of SURG members has been helpful. And some have asked for more information and presentations. So I just wanted to add that.
Thank you, thank you. And we did send the report to the statutory entities that were required to receive it. And we have been asked to present, thanks to Senator Doñate, who chairs the interim HHS committee, I think it is, to present on our recommendations. And so I will be doing that in May. Is it May 13th, Terry?
Yes, May 13th.
May 13th. And so to the extent anyone from our committee in the audience, and maybe even some folks that come up and testify with me on this, that will be fantastic. And so that's the current status. Any further comments on this? Is there another slide associated with this one? This agenda item? Nope. Okay. Okay. All right. So that was for information only. But are there any final comments or questions, concerns, complaints about it? All right. Very well. We'll move on then to agenda item number 11, which is a review and consideration of items for our next meeting. Discussion only. Dr. Kearns, mic's yours.
Yes, thank you, Chair. Currently, agenda items that we have on the July 10th, 2024 SURG meeting are for each of our 3 subcommittees to report out from their May and June meetings. And then a presentation from Nevada's Behavioral Health Workforce Development Center by Dr. Sarah Hunt. And also an update on the opioid litigation settlement funds and distribution, which we have at every meeting. And then the SURG expansion and proposed new members, which it sounds like we handled that today. So that one can likely be taken off. If anyone has any other suggestions, I would welcome those suggestions at this time.
You know what will be interesting, Terry, Dr. Kearns, sorry, shouldn't be so familiar, is what has happened in Oregon. I saw someone else mention this, and that's the recriminalization of certain narcotics there. And so maybe a small discussion presentation, 15 minutes or so, on the trajectory of that particular occurrence in Oregon could be helpful to us. So maybe we can add that.
Okay, we did have that on there, and we are trying to get in contact from some people from Oregon with knowledge on this to look at, you know, what happened, what were gaps, why did it go forward as decriminalization, then went to recriminalization. So we are currently working on that. It's just a matter of getting a speaker and their availability to present at the SURG.
Okay, thank you. All right, I saw a couple of hands come up. I saw Debbie's, and then we'll go to Dorothy. Go ahead, Debbie.
Thank you, Debbie Nadler, for the record. Do you remember when we first started, we had the stats, the overdose stats in Nevada, and I think it only went through 2021, if I'm not mistaken. Is there a way to get an updated, I don't even think 2023 is out. I don't know, but just so we see like the age groups, the, you know, the ethnicity, you know, which kid, you know, the age, all that other stuff. I forget what it's called, but it was a chart y'all had when we first started, and it had broke down the overdose death. I just think it would help us see who's it is affecting.
Yeah, thank you for that, Debbie. I appreciate that. Is that something, Vanessa, that Nancy's working on through her dashboard? Do you know?
Natalie, yes, I believe that's something that she's creating at the moment. We're gathering information.
So perhaps it would be a presentation that she could present to us, Jessica.
Yeah, hi, Jessica Johnson for the record. I also wanted to add the SURG Prevention Subcommittee has been working on trying to identify that for our subcommittee meetings in May or June, depending on availability regarding data. So if we aren't able to do that, maybe that's something for the July meeting, or we can stay in contact with staff about the ability to get that agendized as well. Or maybe share those findings at the larger meeting.
All right, that's great. Thank you for that.
Dr. Dixon has some.
Oh, well, let's go to Dorothy. I'm sorry, Dr. Dixon, are you on the same issue?
Am I what?
On the same issue.
So, yes, somewhat. I was thinking that also the new Clark County opioid committee to look at opioid deaths in Clark County. It seems like it's early. I think they've only had one meeting so far, but it seems like we maybe ought to meet with them and see, you know, see if we're open to what they're doing or if we can help them out.
Yeah, thank you for that. I did present to them as well, and we do have that on our list when they are closer to finalizing their report, that we would like to hear what their findings are.
Yeah.
Okay. All right, Dorothy, I'm sorry, go ahead.
No worries. Dorothy Edwards for the record. I don't know if it'd be too early because we do have a deadline, we being the Regional Behavioral Health Policy Boards, but I'm wondering if this group would be interested in hearing a presentation brief from either me or each of us on what we have selected for our BDRs so that we could solicit support or, you know, information.
Yeah, I think the answer to that is an unequivocal yes.
Okay.
And we'll leave it to you as to when the time is right on that, right? So if you have it done by next time, you know, you can let Terry know, we can get it agendized whenever you think it's ready. Thanks, Dorothy. Other suggestions? Okay.
I do have a comment, just to go back to the previous comment. So for the record, it's not possible to get preliminary data about overdoses or overdose deaths. And it has to be approved by the coroner's office and underwriters before it is considered a death. Natalie let me know that we get the question all the time, and it's not possible because of the number of toxology reports that need to be done. So that's just something I want to make sure that's being.
All right, and who was that was speaking for the record?
Vanessa Diaz for the record.
All right, thank you, Vanessa. That's an important note to have. Okay. Okay, all right, Terry, anything further on this?
No, if there's no other suggestions, and I appreciate those suggestions that the committee members brought forward.
Chair Ford?
Yes.
Laura Hale for the record. Do you want to have an update on the items that come up under the interim Health and Human Services again in July?
Yes, please.
Okay, thank you.
Thank you. Good catch. Okay. All right. With that, we'll move on to the next agenda item, which I believe is public comment. Yes, it is. All right. We will go to public comment now. Again, limited to 3 minutes per person. We'll start with comments in Las Vegas. Do we have one in Vegas for public comment?
Giuseppe Mandel from Desert Hope and American Addictions Treatment Center. Thank you guys all very much. As always, very, very informative. And I do want to make my number available out there to anybody. Love collaboration information. Phone number is 702-283-4962. Again, 702-283-4962. I'm always interested in collaboration and how we can better help the community. And thank you guys all very much.
Thanks, Giuseppe. Any other public comment in Vegas?
Yes.
Okay.
Hi, Jessica Johnson. Oh, thank you, Chair. Jessica Johnson for the record. Just wanted to make an announcement that the Southern Nevada Opioid Advisory Council will be having their Southern Nevada Substance Misuse and Overdose Prevention Summit, lovingly called SMOPS, the 2024 edition of that on August 1st here in Las Vegas at the Tuscany Suites from 8 to 5. So when I save the dates available, I'd be happy to share that with staff to distribute the committee as appropriate. Thank you.
Thank you. All right.
And one more.
All right, go ahead.
So Dr. Dixon, yes, the big group, the ATOD group, is meeting here in Las Vegas, American Academy for Treatment of Opioid Disorder, a national meeting. Well, it's probably international. It's huge when I've gone. And actually, Dr. Richel and I from Roseman are giving a presentation. But it's a big meeting. It'll be, I think it's a Planet Hollywood.
Yeah, it is.
And it's May 18th to the 22nd.
Fantastic. Thanks for that notice. Okay. Any public comment in Carson City? Nope. Okay. Any public comment from virtually on the Zoom here? All right. And how about on the phone? Any public comment on the phone? All right. Hearing and seeing none. Thanks, everybody. We will move to the next agenda item, which is adjournment. And I never know if I got to take a motion, so I will just to be sure. Do I have a motion to adjourn? Y'all just want to hang out with me?
Christine
Debbie Nadler for the record.
There we go. We're going to take Christine Payson. All of a sudden, when I say hang out with me, y'all want to start talking. Okay, Christine Payson gave me the motion, and Debbie Nadler has seconded it. All in favor say aye.
Aye.
Thanks, everybody. You have a great one. We will see y'all next time.
Thank
Bye-bye.
you.
Thanks, everyone.